All right. So, hello, I am Sweta. Everyone knows that. And I'm here with Dr. Felty. And the reason why I brought Dr. Felty on was because not only her posts and everything she was talking about inspired me, but I loved her attitude, the way that she presented herself, her story. And there aren't many doctors out there that have had autoimmune conditions, and unless you've had it, you don't understand it. And that's why I wanted to interview Dr. Felty, because she's had her own battle with autoimmune conditions, and she's healed herself. So even though it wasn't Hashimoto's, all these autoimmune conditions kind of are similar in the sense that they start in the gut. I mean, Hashimoto's was my third condition. So it was after Hashimoto's, I realized that, okay, something's wrong in my gut. I need to sort of fix everything going on instead of taking the shortcut, basically. And for the longest time, I grew up in a family of pharmacists, Western doctors, and they're very much about the Band-Aid approach. I wasn't about that approach. So welcome, Dr. Felty, and maybe you can share your story.
Thank you. Thank you so much for having me. I really appreciate it. And just like you had said, I have been dealing with an autoimmune and inflammatory condition since I was 14 years old. I was pretty healthy before the diagnosis. It really came on very, very sudden. And the symptoms were so detrimental and impacted every ounce of my life. I had to go to the emergency room, and I was in the hospital for about a month, being picked and prodded, trying to figure out exactly what was going on. They came up with a few diagnoses and then finally led to ulcerative colitis, which is an inflammatory bowel disease triggered by an autoimmune and inflammatory response. So for about, I'd say 10 years, I battled with it, and I was on medications. I did lots of procedures, but I never did surgery. And I was just really tired of the allopathic approach to just treating symptoms. No one ever asked me about my diet. They gave me a bland diet to follow, and it just wasn't helpful. They said that I could eat fast food. And so being young and being a young teen, that's what I did. And my symptoms only got worse. And no one really got to the root cause of what exactly was going on and what triggered it. So it really fueled my passion to figure out what was going on, and also to kind of speak out against the conventional model in not a blaming way, because I understand that conventional doctors, they are victim to the curriculum that they are provided. So it is that curriculum that teaches them to prescribe for symptoms and only treat symptoms, and to be really disconnected rather than see someone as whole and have a holistic approach. So I really don't like to blame, the Western approach. I think it's absolutely necessary in emergency situations. I definitely came very close to some emergency situations with my colitis, and so I'm super grateful to the emergency medicine model. However, for chronic illness like Hashimoto's or inflammatory bowel disease, these conditions really get reduced when we focus on what is triggering them and what is the root cause, and how can we help our mind, our body, our soul. Because usually at some point, and I don't mean to ramble, but at some point our soul gets impacted, whether that's when we are a child or whether that's as we are growing up, and we are told that we can't heal and that we have to be on medications forever. And we are told that we're not good enough and that we have to compete. And there's a lot of emotional and spiritual layers here that really drive autoimmunity. When you have autoimmune thoughts, such as, I'm not good enough, I am not strong enough, I can't compare, I am not good enough. It's just those things, you're attacking your soul, you're attacking yourself, and your cells respond. So I learned to retrain my thoughts and retrain my mindset and really help detox my life and work on a lot of emotional wounds that really aren't addressed in the mainstream model. And that's really what I've dedicated and what I'm dedicating my life's work to, is really helping people, not just on the physical level, but on the emotional and spiritual level as well. Because in chronic healing and chronic illness, it really matters that you focus on all of those layers. And each of us are all individual.
Yeah, you're absolutely right. I dealing with autoimmune conditions, those thoughts definitely ran through my mind as a child, and even when I grew up, just because my parents never really said anything positive. They would always point out the negative, and that always put you in the cycle of never receiving any sort of positive reinforcement in life. And I think that's a great start, because I started reading Louis Hay and reading different positive affirmations and kind of healing my inner self, my soul. And then I started healing my gut. And in my gut, I found a lot of different, like I would say, infections like Klebsiella and Serococcus, and there were other immune infections as well. And so basically with that, I kind of been figuring out that, okay, well, the soul is improved. Now I can go to the gut. Is that correct?
Absolutely. And it's interesting because my kind of my path was a little opposite. So I focused on diet, gut health, lifestyle first, which really eradicated my symptoms. But then my symptoms came back after being in remission for a while, because that really wasn't the root of what was going on. And then once I started healing those the inner parts and working on those emotional wounds, then I also now don't have flare-ups. But it was definitely gut health and diet and lifestyle are so huge when it comes to chronic illness and Hashimoto's.
So when you deal with patients who have Hashimoto's, how do you help them reduce the antibodies?
Yeah, well, I do it in a very individualized approach, because everyone responds to elevated antibodies differently. So someone might come in and they might have skin issues, the other person might have brain fog, another person may be dealing with stomach issues. It really just depends on what someone's primary focus is. And then I look at what is weakened in them. And usually it's going to be the liver, and then also the gut as well. So we want to focus on diet and making sure that they are feeding their body with foods that are alive and that are very vitamin rich. So that is really important. I know there's a lot of different protocols and diets out there, Whole30, paleo, autoimmune, ketogenic, but I really like to focus on what works for each person, because some people also have cultural backgrounds and they like to eat certain things. So we have to work with those as well. So I'd like to work on diet. And then also I'd like to definitely work on detoxing them from anything that might be inflaming them. I don't have it with me, but what it is a picture of leaky gut. And what happens is I show them this picture and how leaky gut really begins from multiple factors. So you have medications, you have diet, you have stress, and actually it's right here. So in here, we have this. And so you have stress and toxins and food particles and medications and pathogens kind of like you were talking about, those gut infections. And then what I was mentioning is the liver, which is about right here, organ dysfunction happens. And the liver is really, really important in producing bile and breaking down our food. So if your liver isn't working, then you are not going to be breaking down and digesting food well. And then that leads to bacterial overgrowth. And I usually see about 50 to 60% of people with Hashimoto's that come to see me have some type of bacterial overgrowth. It's very common to be called SIBO. I don't know if you've heard that before.
Of course, yeah.
Yeah, I think it's really, really big in autoimmune healing because it's really prevalent. But a lot of it is being driven by the fact that the liver isn't working. And so what this does is it pulls the gut cells apart. And this all leads to GI inflammation. It leads to food intolerances. And this lovely picture is credited to Dr. Axe. And what this does is the immune system it will activate. And this is what drives autoimmunity. So really autoimmunity is coming from this leaky gut progression. And I try to teach people how to eat in a way that you are going to reduce the gastrointestinal inflammatory process. So what are inflammation provoking foods? So alcohol, sugar, dairy, grains for many people with autoimmune issues. And then also there's so many root causes to what might be going on. And so I'd also might look and see, are they dealing with Epstein-Barr virus? Are they dealing with Lyme? Are they dealing with mold? Because all of these different infections can really trigger autoimmunity and increase antibodies. So I help them with diet. I help them with leaky gut. We usually will do vitamin deficiency testing to find out what they're deficient in. I also will do stool testing to find out, like you had mentioned, what might be overgrown in their gut and what also might be driving this gastrointestinal inflammation. And everything that I recommend is really to help balance their immune system and balance their immune response rather than suppress it. You know, we don't want to suppress it, we don't want to drive it, but we do want to balance it. And I find when we do vitamin deficiency testing and a full blood work panel, I usually find that they are deficient in vitamins, which also can be driving this liver dysfunction and driving their immune imbalance. But then they also might have hormone imbalance. I find that a lot of women who have Hashimoto's, a lot of times they do not have enough. It's called DHEA. Have you heard of this before?
Yeah. So is
Yeah,
that like that's the DHEAS?
exactly.
Uh-huh.
Yes. And DHEA is super important to help you produce hormones. It comes from cholesterol. And a lot of times when we have a low DHEA or low testosterone, women can experience worse Hashimoto symptoms. And if they're not being tested for that, and a lot of times primary care docs don't test for these unless you ask for them, you won't know if you're low in it. So it's pretty important to balance your DHEA levels and your testosterone because it can really help with your symptoms. So there's a really holistic approach that I do. And then also emotionally, what's going on? You know, are they happy? What's been on their mind? You know, what have they been dealing with? Have they been going through a stressful time and driving, their body's imbalance? And then another thing is removing and detoxing chemicals, plastic, pesticides, really removing things that drive imbalance in the body is really important. And then I also find that low dose naltrexone, it's an anti-inflammatory treatment for chronic pain, but I have talked to many naturopathic doctors who find that it can be really particularly helpful in lowering antibody levels and reducing inflammation and reducing chronic pain. So, I like an integrative approach, a holistic approach, and really supporting the mind, the body, and the spirit. So even when I'm doing this, I also might talk to them about their spiritual practice, their meditation practice, their exercise. I probably will do Reiki on them, distance or in person, to really support their energy and calm them and make them feel safe. So it really just depends on the person, and kind of what's going on. Because some people come to me with high antibody levels, their diet's perfect. They've been on an autoimmune diet for a while. So what is driving it? Usually it's an infection.
That's so interesting because a lot of people, in this group of women, they eat very clean, and they want to know, why do they still have Hashimoto's when they cleaned up their diet, they're, taking their supplements, and I've always thought that it's not what you're putting in your body, it's what you're absorbing, and how can you really absorb what you're eating if your gut is not working?
Yeah, exactly. And speaking of the gut and not working, a lot of women don't realize that about 10 to 20% of women who have Hashimoto's have celiac and don't know that, gluten is found in trace amounts in certain things, and that could be driving their chronic inflammation. So it really matters to understand the whole picture for someone and their environmental toxins. I think that's a big thing too. If their diet is really clean, looking and seeing where may you be getting chemicals or plastics or heavy metals that could be driving something. Or, like I said, those stealth infections, Epstein-Barr virus, can really do a number on the thyroid and makes people feel really crummy when they don't know they have it.
Yeah, and what other sort of infections have you seen out there in terms of dealing with patients who have Hashimoto's?
Yeah, I've seen cytomegalovirus, Epstein-Barr, Lyme. I've also seen, and in the gut, I've seen a few things. I mean, I've seen overgrowth of Candida. I've seen overgrowth of, like you had mentioned, Klebsiella, but also other guys, Citrobacter. I mean, lots of different pro-inflammatory um, bacteria. It's really in the Proteobacter species like Prevotella. These guys really drive inflammation.
Wow. So, and then I just want to have Raquel chime in if she has any questions for you so far. Do you have any questions, Raquel?
Um, there was one. I have a couple, but I'll just ask one. But like, how do you get rid of the bacterial overgrowth if you have it in your gut?
Yeah, it's a really great question. So, depending on the actual bacteria or fungi or parasite, and that's another thing I didn't mention, parasites. Parasites are definitely an issue for many people and they don't realize it. So it depends on the microbe itself, Raquel, because if it's a bacteria, you want to do an herbal antibiotic. But if it's a virus, you want to do an antiviral, parasitic, Candida, you want to do an antifungal. And then along with those things, I usually will do a comprehensive approach. So not just killing the microbes, but then a lot of times when you are dealing with autoimmunity, we have to break down, it's called biofilm. Have you ever heard of this?
Yep, I have.
Okay, so we have to break down biofilm, and I do that with a number of different enzymes. And I also will use binders depending on the person and depending on what's going on to bind the microbes once we kill them. And then making sure your liver is working to detox, because a lot of times if your liver is low in B vitamins, vitamin C, magnesium, glutathione, amino acids, if it's low in any of those, your liver's not going to detox well. So you can kill all those microbes, but if you can't produce bile and you can't detox them out, now you're releasing them, and now you might feel even crummier if you're not able to open up those detox pathways. So I always will look at vitamin deficiencies and focus on those, so that way we can open up the detox channels, along with making sure that you are not eating more things that could cause inflammation in the gut. So figuring out what works best for you. In gut health, I really love the paleo diet, but I know that one size doesn't fit all. Some people don't work well with that. So it just depends.
I remember with my infections, I used something called biocidin to sort of kill off the infections, and it reduced them. But it's not like everything helps, I think, and as soon as my diet was clean, and instead of eating like 6 times a day, I started eating like 2 times a day, and that made a huge difference. Like less is more when you're dealing with inflammation.
Yes, I couldn't agree more. I really couldn't. And that's another thing also, Raquel, is when you have bacterial overgrowth, you want to make sure that you are not eating foods that you may be allergic to. So testing food intolerances may be beneficial for you. And then also the way you eat, making sure that you're not stressed or anxious or on the run when you're eating, because your body needs to be, your mind follows your thoughts. So if you are present and you're focusing on digesting, then your body is going to also be focusing on that. But if you're focusing on your phone or the TV, your body isn't going to be 100% present in digesting the food you're eating, which means less absorption of those vitamins to help clear out those toxins.
Okay.
And there's a lot of women in the group that have trouble, I guess, when dealing with Hashimoto's and emotions. They have trouble letting go. So, have you seen that with your Hashimoto's patients?
Oh yeah, yeah. And just in chronic illnesses, just in general, I find that there is an emotional component with fear. And also when we subconsciously are being driven by thoughts that we're really not conscious of, it's difficult because we want to let go, we want to move on, we want to heal, but a lot of times our subconscious thoughts keep us stuck and don't allow us to let go fully. So I think subconscious work is really, really important when it comes to autoimmunity and Hashimoto's.
Yeah. Like, do you use like certain sort of methods and like different affirmations, or how do you
Yeah.
sort of channel that?
Yeah, absolutely. So I provide naturopathic counseling, and it's so individual. It really is. A lot of it's intuitive for me. I mean, I had one woman, I just spoke with her on Friday, and she's Hashimoto's patient, and she has been struggling. She's been eating all the foods. She's been doing all the right things. She's taking her supplements, but she just is kind of stuck. And intuitively, I asked her, what might be driving her feeling stuck. And one thing led to another, and we get to the fact that her mother believed a certain thing when she was growing up. And when I asked her, you know, what do you think that's doing to you? And she goes, well, I guess I believe the same thing, even though I know it's wrong. And I said, how does that make you feel? And she's like, it's no wonder I'm stuck. And it was just this like beautiful breakthrough that we had. But it's so individual. And I think that working with someone and finding a mentor or a coach to be able to talk about your thoughts and really express yourself, because I find that when we're young, you know, we're really suppressed and we're not able to express ourselves fully. And when we're older, if you're expressing your thoughts, then maybe some of those subconscious thoughts can come out, especially when you're working with someone who's really good at bringing them out and bringing them to shore.
You're so right about that. And there's so many healers out there. I myself worked with a few healers because I didn't really have any family members. I didn't have any friends I could connect with. And for me, I needed the guidance. I was, I mean, you know, the world is uncertain right now, but when you're uncertain about your health, when you're uncertain about so many different areas of your life and you're alone, it's like, what do you do? Yeah. So,
Yeah.
so
Yeah. I agree. I agree. And I can't stress enough the importance of really working with someone to really help guide you. And there's so many different modalities. Hypnotherapy is a beautiful one. That's really benefited me in a lot of the patients that I've worked with. And so hypnotherapy, and another way of doing some subconscious work is also working with a shaman. That has helped a lot. But otherwise, an actual therapist to just talk to can really be helpful. I really like EMDR as a practice. But a lot of the subconscious work can be done on your own. It really can, when you are journaling and in prayer and in meditation.
absolutely. You know, like for me, even when I was sick and like you said, doing everything to a T, I got rid of my EBV and my
Can you hear
thyroid.
me? Because I can't hear you guys.
Oh yeah, I can hear you.
I'm so
We can hear
okay because
you.
I can't hear you, and I'm having internet connection that's problems. That's why I keep moving rooms. I
Oh,
apologize for that, but it keeps
It's
coming up
okay.
saying that my internet's unstable,
oh,
but I can't.
you can't hear, huh? Let me okay, how about now? Can you hear us or
Hmm.
no?
I wonder. I'm so sorry.
Let me
It's okay.
try one more thing. How about no. Can you
I
hear?
wonder
Can
if
you
I
hear
should hop
us?
off and then hop back on.
Maybe, yeah, try that. Can't hear us, huh?
Let me see.
Okay. Yeah,
Volume.
you know, it's interesting with like healing. Even when I had healed these infections, I didn't get better from Hashimoto's. You know, I got rid of my EBV and my TSH and all these numbers actually increased. Um, it went to like 6.4, and I was basically on the couch and couldn't get off. And I think there was so much uncertainty in my life, and it was so overwhelming to me that I didn't even know how to process it. But every day I had told myself, "Oh, I'm getting healthier. I'm getting healthier," and you know, like that was a big sort of shift for me because as I started saying that, you know, you start believing it, and so, like, have you ever had patients where you clean up their infections, you know, they're eating clean, their gut is semi-working, that they still haven't healed yet?
Oh, yeah. And usually it's always mental, emotional, spiritual. And that's the next layer that we need to work on. And I kind of love it when that happens, because usually it means that they're about to have a breakthrough. And they always do. Because it's usually they're so frustrated because they're like, I've done it all. I was feeling great and now I'm feeling worse. And usually I'll ask them, do you feel like you deserve to be healthy?
Yeah.
Do you feel like you deserve love? Do you feel safe? Do you feel like you're on purpose? And then usually it's like, no, I don't. And, all these things. And it's so important. And I think making sure that someone feels happy, and not happy in a superficial way, but content, I would say is a better word, in their life and in who they are. If they don't feel that, then there's still more healing to do. And I think that it never really stops.
Right. And I think, with all this work that you do, from your body to your mind, it has to align with your purpose. And I think that's what my journey was teaching me, was that, I was going in all these different directions, kind of lost and confused and didn't know what I was doing at certain times. But at one point, everything will come together. And you see that, like, for me, a big difference was the hormones. I had another autoimmune condition before this, and I had taken prednisone for 3 years, and it basically ruined my adrenals. And the adrenals being taxed can totally ruin your thyroid. So
Yeah, big time.
that was and every doctor I went to kept giving me thyroid medication, and I didn't need it. It was not doing my body any good, and actually messed it up even more instead of just fixing the adrenals.
Right, right. And that's another huge thing. Not only prednisone, but these microbes, Epstein-Barr, mold, they mess with the HPA axis, that stress axis, and stress management. Honestly, Sweta it's literally, I would say, one of the top priorities when it comes to healing, and like enough rest.
Great. Well, I would like to open it up for Q&A then. Any other questions, Raquel?
I never thought, like, subconsciously working on like with the trouble of letting it go. I want to think that it never crossed my mind that would have an effect on your thyroid. Because I had a horrible upbringing in my childhood, so there's a lot of trauma and stuff there. But as an adult, I've kind of just let it go. I've never really worked on it with somebody, though. I've let it go in my own way. There's still a lot of things that are triggers, and that I think there's a lot more in there. And I think that's causing a lot of my issues. I have other health issues as well, not just my thyroid. And I think they kind of all go and coincide with each other. So that I don't know. I've never thought of that. So, that's a good way of thinking and letting it go and working on that.
Yeah. And Raquel, there's another thing, and Sweta, I didn't mention, when it comes to subconscious work, I think psychedelic medicine and breath work, along with hypnotherapy, I would say those are my top three modalities to use to help someone explore their consciousness and let go and resolve trauma.
Okay, I do the breath work now, not the psychedelics. And then what was the third one you said?
Hypnotherapy, especially hypnotherapy with EMDR, because a lot of times with people with autoimmune issues, we're really strong. And we've been taught to like be really strong and like have this front, like everything's fine, everything's good, I got this.
Yeah.
But really it's not. And I don't know if you guys can resonate with that or not.
Well, it's not, because we're alone, and I think we can't connect with other people because of that front, because everyone thinks we're all healthy and normal, and we're really not. It's just a front.
Yeah. And it's, I think a lot of times with autoimmunity too, especially for young children who have grown up in tough homes or tough experiences, they've had to pretend that everything was fine for probably a long time.
Yeah.
And that builds and causes physical issues in the gut, in the adrenals, in the thyroid, in the reproductive area. I mean, we can also go into like the sacral chakra, the throat chakra, and how the chakras become imbalanced. And a lot of work that I'm doing now too with autoimmunity is helping women really foster and nurture their relationship to themselves in a sexual way that a lot of times has been suppressed when they were younger, and really helping them feel connected to themselves and feeling like it's okay to pleasure themselves, or to tell their partner, hey, this is how I need to be pleasured, rather than you first. I think we've grown up in a culture where we are shamed and we are also not taught how to be pleasured. And I think that plays a huge role in our overall health. I don't want to go into that tangent too much, but any thoughts on that?
Yeah, I mean, in my relationships, it's always been with like these narcissist sort of men. So I kind of detached myself from that sort of toxic relationship in my life, and started building more relationships around just myself and discovering who I am, finding who I was, because I lost myself in that, in those sort of relationships that were not good for my soul, good for my heart, and didn't really propel me forward.
Yeah, good for you.
So that was a hard lesson, though. It wasn't overnight.
I've been there too.
When you mentioned like psychedelics, is that like THC? Like,
Yeah.
I tried THC one time by mistake, at my best friend who has Hashimoto's as well. And she had a birthday party, and she had like all these gummy bears and things out. And it had 20 grams of THC in it. And I was fasting that day. And that was
Oh
the
my
first
gosh.
thing I ate after an 18-hour fast. So that, like, I literally felt like I was dizzy, having a heart attack, and like, so I went around her whole 40th birthday party, was like, hey guys, I'm dying. I'm gonna die before I'm 33.
Oh my gosh.
And thank God, my acupuncturist was there. Otherwise, she kind of calmed me down and, measured my pulses, and she's like, you're not having a heart attack. You're okay. But after that, I never like tried anything of that sort ever again.
Yeah. Oh my gosh. I understand. That can be horrific. Definitely. And 20 milligrams that's a lot. But that is actually not, when I say psychedelic medicine, I'm not talking about THC. I'm actually talking about psilocybin, which comes from the earth, which is a mushroom. I'm talking about LSD, which is found in the clinics, not like a party recreational form of it. And I'm talking about ketamine, which again is a insurance-based scientific medication now for PTSD, trauma, depression, anxiety. And so I'm I'm currently in a program right now to be a certified psychedelic therapist, because that is one thing I think most people who've been through trauma, it's the one thing to really support their healing in a way that nothing else can. Because when you do a psychedelic experience, you are not partying. You are having a totally healing experience. And whatever comes up for you is what you need to work on and push through and overcome and free yourself from. And it's pretty beautiful. It can be sad. There's a lot of times when I've done psychedelic medicine, and every single time I think, okay, I've cleared a lot, but each time there's something else in my childhood, even when I've been in the womb. You see things in different perspectives. There's been times where I see my mother and how her upbringing, it was really, really hard. And so it helps me not blame her for all the trauma that I've had. There's a lot of consciousness work that can be done with psychedelic medicine. And I think it's really the future of mental health, because really medications haven't been able to support and heal psychology over the past 60 years. So I think now the research is just accumulating to really help people in this way. And the nice thing with psilocybin is you can do psilocybin in a healing setting, eyes closed, relaxing music, and that is like 6 months of therapy in 4 to 5 hours. And you do some deep work, and it's, like I said, it's pretty powerful stuff when you do it in a healing environment. I don't recommend it in a social setting, in a party setting. It's not for that. It's really for healing. And I think that's why God created it. It's a technology for us to evolve.
Yeah, you're absolutely right. I mean, you can go to a therapist, you can pay somebody to help you get clarity you need, but I think, in the right dose, if I had maybe taken 5 instead of 20, I probably would have had a different experience.
Yeah, and THC is quite different. Now, don't get me wrong. I love CBD and THC, especially for chronic illnesses. I highly recommend getting a cannabis card if you do have an autoimmune issue, especially because you don't get taxed, you don't wait in line, and it can be super beneficial if you have anxiety or sleep issues or inflammatory issues. I find that if you can do the right dose, usually it's a CBD THC hybrid blend of 1-to-1, where it's not too much THC. That's usually the right dose for people with autoimmune conditions. But if you do anything with THC, where that's the dominant, where it's like 2-to-1, that can cause anxiety. So that's why I always recommend making sure it's blended well.
Great. Wow. We've covered so many things today, antibodies to emotional triggers to psychedelics. It's been a great conversation, and I'm so glad that we were open and you were able to share your story and able to help others with it. And how do these women get in contact with you if they're interested?
Yeah, thank you so much, Sweta. I really appreciate you having me on. And they can email me. My email is info@drfelty.com. They can go to my website, drfelty.com. They can follow me on Instagram or Facebook. It's just Dr. Felty is my, I don't even know what that's called.
Handle.
It's not a hashtag. Thank you.
Handle.
Yeah.
Well, thank you so much. And Raquel, if you don't have any questions, do you have any other questions or?
No, but my friend actually is kind of doing the same thing with the mushrooms. She's actually helping people therapeutically. She does a lot of microdosing, and she thinks that I would benefit from it with just all the trauma and stuff and all the health conditions I have. So I don't know, with you saying that as well, I don't know. It's just, it's coming to my forefront, like in the last 2 months. This is like the third time someone's mentioned it. And the same thing, it has to be in a setting. And you kind of have to have a person there to help
Yeah.
work through it. So I did
Yeah.
hear a lot about that. So I don't know. I think I
Yeah.
might look at that a little bit. I had the same thing though that happened to me. Like I get super paranoid. I don't do that kind of like. I get really paranoid. So I've tried it a couple times, and but that was with THC as well. So I've never done anything else. And
Yeah.
so, but it there's a trigger there when I think about it. I'm like, oh no, what happens if that happens again? You know.
Yeah.
So, but
Raquel, I totally get it. And honestly, that's why I'm in the progress of being a therapist and guide, because I've already helped people before and after they do their healing session. I've helped them during their healing session. I've done it in person and virtually, and both have worked out really great. So if you need that support, you just let me know, because I'm super passionate about helping people in this way, because it's like I said, it can be really transformative. It can be scary, and that's okay. Also, but know that you're not alone, and I'm happy to help you if you want to reach out. We can set something up.
okay, thank you so much. I appreciate that.
Yeah.
Great. Well, thank you, Dr. Felty, and thanks for coming on the interview today and sharing your time with us. And I will share ways that they can get in contact with you.
Thank you.
All right. Thanks.